Could your ear crease be a heart attack warning? Find out! Did you know that over 50% of Americans over 45 are unknowingly living with a silent threat to their heart? That's right. Atherosclerosis, a condition that can clog your arteries and lead to heart attacks, is far more common than we realize. But here's the thing. Early signs of heart disease don't always show up as chest pain or shortness of breath. They can appear in ways you might not even expect, like a crease in your ear or even hair loss on your legs. In the next few minutes, we'll dive into the 9 most common symptoms of heart disease you need to know about, and how recognizing them early can make all the difference. Stay with me, because this could be the first step in saving your heart and your life. Let's begin. Number 1. Frank's sign, the crease in your ear. You may have heard of this one before, but let me explain it in a little more detail. Frank's sign refers to a diagonal crease in the earlobe. It was first identified by Dr. Sanders Franks in the 1970s as a potential indicator of heart disease. While not foolproof, research suggests that people with this crease have a higher likelihood of cardiovascular issues, including coronary artery disease. In a 2012 study published in the Journal of the American College of Cardiology, it was found that individuals with Frank's sign have a 40% increased likelihood of having heart disease. So while not a definite predictor, it's definitely worth paying attention to. And if you notice that crease, don't panic, but do get it checked out. Number 2. Hair loss on your legs. Now this one might sound odd, but hear me out. As a podiatrist, I frequently see patients with poor circulation, and one of the first signs of vascular problems I notice is hair loss on the legs. You might be thinking, okay, I'm just getting older. But this symptom could be an early indicator of peripheral arterial disease, or PAD, where the arteries in your legs become narrowed or blocked. In fact, a study in vascular medicine found that hair loss on the lower legs is an independent risk factor for PAD. If you're experiencing this but have normal hair growth everywhere else, it's definitely worth mentioning to your doctor. Number 3. Male growth issues, toenails not growing. Now, let's talk about your toes. Are your toenails growing as they should? Or do they seem to be slowing down, or worse, falling off? Nail growth is directly tied to blood circulation. If your toenails aren't growing back after injury or seem unusually slow to regenerate, this could be a sign of poor blood flow, another indicator of atherosclerosis or PAD. The reason is simple. Blood carries oxygen and nutrients to your tissues, including your nails. If the flow is disrupted, those nails will suffer. And while this isn't an immediate cause for alarm, it's a clue that something might not be working as it should. Number 4. Capillary refill time, a quick screening tool. Here's a quick test you can do right now. Press on your nail until it turns white, then release. The nail should turn back to its normal color almost instantly. This is known as capillary refill time, and it's a good indicator of how well your blood is circulating. If it takes longer than a second or two for the nail to return to normal color, it could mean that your blood vessels aren't getting enough oxygenated blood to where it needs to go. I often use this as a first-line screening tool with my patients. It's simple, but it could point to an underlying issue, like atherosclerosis or peripheral arterial disease. If you're noticing a delay in refill, it's a good idea to consult your healthcare provider.
Number 5. Xanthelasma, cholesterol deposits around your eyes. Have you noticed any yellowish bumps or patches around your eyes? These are called xanthelasma, and they occur when cholesterol deposits form just beneath your skin. It's a clear sign that your cholesterol levels may be higher than they should be. and as a result, your arteries could be at risk. A 2013 study in the American Journal of Clinical Dermatology found that xanthelasma is associated with a higher risk of cardiovascular disease, particularly coronary artery disease. If you have these deposits, it's a good idea to get your cholesterol checked and work with your doctor to manage your heart health. Number 6. Senile Arcus, a halo around your eye. This one's a little tricky, but let's break it down. If you have a gray or white ring around the iris of your eye, it could be a sign of blood flow issues. This condition is called senile Arcus, and while it's often seen in older adults, it can also be a sign of high cholesterol levels and poor circulation, which directly impacts heart health. Senile Arcus is often dismissed as just a normal sign of aging, but research suggests that it could be linked to higher cholesterol and an increased risk of cardiovascular problems, so it's something worth having checked. Number 7. Cold extremities, blue or purple skin. If you've ever noticed that your hands or feet feel cold to the touch or have turned a blue or purple color, this could indicate cyanosis, a condition that occurs when oxygen isn't reaching your extremities. Cyanosis can be caused by a number of factors, but when it's related to the heart, it means that your heart isn't pumping blood effectively, causing a backup of oxygen-depleted blood in your extremities. This can be a serious issue, and if you're noticing this consistently, it's time to see a doctor. Number 8. Swollen feet and ankles, a sign of fluid retention. Let's talk about swelling, specifically in the legs and ankles. Swelling can happen for many reasons, but when it's related to heart disease, it's often because your heart is struggling to manage fluid. When the heart isn't pumping effectively, fluid builds up in the lower extremities, causing swelling. If you notice that your legs or ankles are swelling and it doesn't go away after elevating your legs, it's a good idea to consult with your healthcare provider to rule out heart disease or other vascular issues. Number 9. Varicose veins and spider veins. More than just cosmetic. Finally, let's talk about varicose veins. These swollen, twisted veins are often seen in the legs, and while they're a common issue, they can also be an indicator of poor circulation. When your veins are overworked due to weak valves or blocked arteries, they can start to swell and become visible through the skin. This is often a sign that your heart is struggling to push blood down to your extremities. If you're dealing with varicose veins, it's important to get your heart health checked. Your doctor may recommend lifestyle changes, compression stockings, or in some cases, surgery. What can you do about it? So, what's next? If you recognize any of these symptoms in yourself, don't panic, but do take action. Here's a step-by-step approach to improving your heart health. Get checked out. The most important thing is to see a doctor. Whether it's for a blood test, a heart screening, or just to discuss your symptoms, early intervention is key. Embrace a healthy lifestyle. Start making small, manageable changes. Eat more fruits and vegetables. Get moving with regular exercise and manage stress in healthy ways. Medication. Depending on your condition, your doctor may prescribe medication to manage cholesterol, blood pressure, or blood sugar. Quit smoking and limit alcohol. Both smoking and excessive alcohol consumption can significantly increase your risk of heart disease. Cutting back can have an immediate positive impact on your cardiovascular health. You've taken the first step by learning these warning signs and understanding the power of early intervention. Heart disease doesn't have to be a death sentence. It's a wake-up call. You have the ability to change the course of your health starting today. Small, consistent steps like making healthier choices, getting regular checkups, and staying active can add years to your life and protect your heart for the future. Don't wait for the symptoms to take over. Take control now. Your heart deserves the best care,
and you're the one who can provide it. If this video helped you, don't forget to like, share, and subscribe to our channel for more life-saving tips. Click the bell icon to stay updated on the latest health advice that can help you live a longer, healthier life. Together, we can keep our hearts strong. Stay strong, my friend, and keep moving forward. You've got this.